To perform a central line dressing change, I'll begin by assembling my equipment. I'll need a central line dressing change tray, clean gloves, and a mask for the patient. I will perform hand hygiene and identify the client, provide privacy, and explain to the patient what it is that I'm going to do. I want to position the patient in a supine position and give the patient the option of turning their face away from the insertion site of the central line or of wearing the mask. With this particular tray, the bottom is clear, and I found it best to have the clear side down when you open the package. I'll remove the mask, and this I'll put on. I'll remove the sterile gloves. And I'll remove the drape. I'll use the drape to cover part of the patient's chest. And then sometimes it's more practical if you loosen just the very edge of the tegaderm, because once you have your gloves on, that's going to be very hard to do. And particularly on these models, the tegaderm really wants to stick. So just barely loosen up the ends before you put on your clean gloves. Now I'm going to carefully remove the old dressing from the outer edges towards the insertion site without pulling on the catheter. I want to inspect the site for any swelling or redness, and I want to feel around the site to see if there's any crepitus. I want to make sure that I don't touch the insertion site itself. I'll remove my non-sterile gloves, perform hand hygiene, I'm going to put on my sterile gloves. I'll begin by cleaning with the alcohol swab sticks. And I want to start at the catheter itself and work in a circular motion and clean an area about 3 inches in diameter. I'll repeat that with each alcohol swab stick. And I'll allow that to air dry. Next, I'll use either the betadine swab sticks or the ChloraPrep to clean the site. For our purposes here today, I'm going to not use the betadine because it'll stain the model. But it all depends on hospital policy, what you use to clean the site with. So again, I'll start at the insertion site and clean in a circular motion. Over an area about 3 inches in diameter. I'll also let that dry. I'll cover the insertion site with a transparent dressing. And I'll make sure it's secure. And once the transparent dressing is on, I can remove my sterile gloves, I can remove my mask, and I can remove the patient's mask. I'll want to remove the window pane or the outside edge of the transparent dressing. There's a label. I want to put the date, the time, and my initials on that. And I'll apply it to the edge of the dressing. I'll take a piece of tape and secure the end of the catheter so it doesn't catch in the patient's clothing. Finally, I'll dispose of all my used materials and I'll document the procedure, including what the site looked like. You may notice that in your kit there is also a tape measure, and this is used to monitor the length of the catheter that is exposed, starting at the insertion site and ending at the tip. You'll also find a betadine prep pad or sometimes antibiotic ointment to apply to the insertion site. Depends on hospital policy whether you will do this or you won't do this. There's also a 2x2 drain sponge. You may or may not use this per hospital policy. When it is used, the disadvantage is that it does block your view from the insertion site, which you want to be monitoring for redness or swelling.